Good morning, friends. Welcome to another session of conceptual surgery. And today we are going to talk about abdominal incisions. We all know that for a general surgeon, abdominal surgeries are the mainstay of the profession and the clinical craft. And incision marks the first point in those steps. And it is somehow said that a lot of your success about your procedure and the outcomes will be based on abdominal incisions because it will define the access, how comfortable you are to the organ you are intending to operate on, and also once the patient is when the surgery is done and the patient recovers, the only thing patient is able to observe very closely is the incision and the scar resulting from it. So it is very important to know the incisions, various incisions, and which incision to use where, and what is the uh, fundamental difference between different incisions, so that we can use an appropriate incisions for our surgeries, and the outcomes are much better. So that's what we're going to talk about today. So what is an incision? Incision is a cut which is made typically by using a sharp instrument. Typically, we use a scalpel. Also, sometimes a hot scalpel or a cautery can also be used to make incision. So, and today we'll restrict to incision those which are used to open the abdomen. The incision, as you can see, it can be used in different body parts and also over the viscera also. Like you can give incision on the bowel or on a pelvic system in kidney and so on and so forth. So while choosing incision, we should keep in mind one, what are we going to access? So the incision should be able to give us a good access to the intended area without much struggle. If required, and if we are predicting that we might need to extend the incision, so incision should be such that we are able to extend the incision easily without compromising other structures. Uh, it should be safe incision, as means it should not injure blood vessels, nerves, and other things. And also, the closure of it should lead to an reliable healing and less chances of late complications. So, some principles which we all follow as surgeons are that incision should be long enough to give us good exposure. Now, here I want to emphasize that many people would think that can we give a smaller incision and use retractors to get access to the viscera? So I would suggest that no, it is not a good idea. Remember, for body tissue, especially muscles and fascias, cutting is still a better injury to give rather than stretch injury. So muscles after a stretch does not heal very well, whereas after cutting and repairing them and suturing it back, it leads to a very good suturing. Also, while giving traction, we leave behind a lot of dead tissue, which can lead to some collection and infection. So the rule is that give as big as incision as you need, rather than giving smaller incisions and then struggling and then putting too much of pressure on retraction. Okay. Another thing is if you have to have an option of to split the muscles and cutting it, the splitting muscles are better than cutting. So splitting means along the line of the fiber of the muscles of fascia, if you can create a divide and then just split them without cutting individual fibers, that is better. You should be aware of the anatomy of the nerves, vessels in the skin, subcutaneous tissue, and muscle, so that we avoid putting incision over these areas and avoid injuries to nerves and vessels. Also, as I'm sure it is emphasized again and again, that you should be aware of Lange's line around different body parts, and as shown here. So, whenever giving incision, try to follow Lange's line, and it will lead to better cosmetic healing. Uh, Always think about cosmetic factors and patients' concern about cosmesis. So, if there is a choice between giving incision on the center of the abdomen vis-a-vis giving incision in the lower abdomen, which can be hidden in the under the undergarments. So consider giving the latter one so that cosmetic is better. Do not try to give big incisions, which will be very visible in post-operative period. So this also is a factor which we should think about before deciding the incision. Uh, One important point is when we give incision, and let's say in the surgery, we need to put some tubes or drains in the post-operative period. Please never put out anything through the main incision side. No stoma, no drains, no foreign body should be placed through the main incisions. Try to make a separate opening and then bring it out. The main reason behind this is it reduces the chances of infection or complication in the main wound, and the other wounds, which are generally smaller, are the only thing at risk. So it maintains, still keeps the main incision safe. That is very important to avoid post-op complications as well as incisional hernias still later on. As a rule, general experience says that vertical incisions heals less better, like transverse are better in terms of healing incisional hernias, access also. So transverse incision generally heal better than vertical, but that is one factor. Now, vertical incision had its own advantages. Transverse has its own advantages. We have to see, like transverse cosmetically may not be very good, but we have to see for what we are doing. The overall rule, the healing is of transverse incisions is better than vertical. When we are closing incision, what all layers we divide, all the layers have to be closed ideally layer by layer. So if you're cutting skin and then fascias and then muscle and then deep fascia and then the peritoneum, ideally it should be closed all layers individually. That will lead to better healing, less of adhesions and less of complications. Anatomy knowledge is must before planning, before you, so that you are able to give a good incision. So you should be aware about the various muscle, their insertions, where it is muscular, where it is fascia, and so on and so forth. So it's very important to know the muscle anatomy, the how they are arranged in depth. So if you can see here, it's important to note that you will have a the vascular bundle just on the lateral border of rectus abdominis. You should be aware that there is a avascular, without any muscle plane in the strip midline. You should also note that there is a kind of a plane right at the lateral side of the abdomen, which we can access without cutting any muscle. So these kind of informations are important. Also note, if you will make an incision on the lateral part of the abdomen, you'll have to cut through the muscles. Whereas if you cut in the midline, you may not be, you can access still without cutting any muscles. So these kind of things are important to decide what muscle, what incision we want to use. Also, this diagram shows you the arrangement of various vessels, and that you'll keep in mind. So for example, if you see in lower abdomen, you can see one major vessel which is going up. It is it's a superficial epigastric artery, and when we do a inguinal hernia surgery, this vessel generally gets divided. So if you're aware of these vessels, you'll predict it, you'll control it before cutting it further. So this avoids blood loss. This avoid unnecessary swelling of the surgical field. Also in upper abdomen and the deep layers, you know that where all muscular networks will be there. Also, if you see laterally, the nerves are dominant. So when giving lateral incisions, you should know that deep down the nerves will be there.